Hello everybody and welcome to the Thursday edition of Video Clips, and I've chosen a couple of things I think are kind of interesting to talk about. I want to start with a major health concern that everybody is talking about today is the opioid addiction crisis. Believe it or not, here in Ohio where I live is one of the worst places in the country for all of this. According to an article in the Columbus Dispatch, Ohio leads the country in opioid overdose deaths and had the most deaths from heroin, with 1 in 9 heroin deaths in the U.S. taking place right here where I live. As if that's not bad enough, 1 in 14 U.S. deaths from synthetic opioids takes place in Ohio too. Now things here are getting worse instead of better. I think in the last probably 2 or 3 weeks, the front page of our newspaper every day has had some article that covers this issue. And the trend is the same in other places in the United States. I've also heard that New Hampshire, interestingly enough, is a hotbed for this kind of activity, but there aren't any areas that are left totally unscathed. Now, there are a lot of contributing factors to this situation, and I don't think solving it is going to be easy. But the one I want to focus on right now is the number of people who start their addiction or their descent into addiction because they are suffering from pain. Much of the treatment that is offered for pain is ineffective, such as surgeries that aren't warranted and don't improve outcomes. Now, I won't go into that here. There are lots of articles in the Health Brace Library. And I've even done, on this YouTube channel, I've featured my good friend, physical therapy guru, Eileen Kopsaftis, talking about and demonstrating how she resolves knee issues and shoulder issues. And this woman just, we call her our physical therapy guru. So I'm not going to go into that here. So better resolved with her type of therapy than surgeries. But pain medications are prescribed before and after surgeries, but more and more on an ongoing basis to manage pain as a standalone thing. And if you watch ads on television, you'll see that this is becoming more prevalent with over-the-counter painkillers being advertised for daily use. And the competition is, oh, I use this painkiller because I only have to take it twice a day. And when I was using this other painkiller, I had to take it every 3 hours. So the promotion of taking painkillers on a regular basis for pain instead of addressing the issue has become quite common. Now, some people think the answer to all of this is we look for drugs that are less addictive. But I think much better solutions are the type of physical therapy offered by our physical therapy guru, which can help a patient to feel better after the first session and often resolve pain within a short period of time without any procedures or drugs. But another better solution is the use of acupuncture, which has been proven to relieve pain instead of drugs. 300 patients who visited an emergency room were randomly assigned to either get acupuncture or to be given morphine. The reasons for the emergency room visits, most of them, were the types of things that the physical therapy that I mentioned earlier are really effective for treating. So these would be acute musculoskeletal pain without any evidence of fracture or dislocation, ankle and knee sprains, shoulder and elbow tendinitis, and low back pain. The success rate was considerably different. It was 92% of those receiving acupuncture versus 78% with morphine. The average time to achieve resolution, much shorter for the acupuncture group than the morphine group, which is kind of surprising. You'd think the drug would work faster. But there was a huge difference in the side effects, only 2.6% in the acupuncture group versus 56.6% in the morphine group. So the researchers concluded that acupuncture was more effective, worked more quickly, and significantly less damaging than taking morphine. And of course, if you were to get addicted to acupuncture, it certainly wouldn't have the same devastating effect as being addicted to morphine. So it seems that most emergency rooms should have an acupuncturist on staff, and that it should be offered instead of drugs as a first-line treatment for people who show up in the ER with significant pain. Medical doctors outside of emergency room settings should be educated as to the value of acupuncture, since most opioid and other pain-relieving medications are prescribed in doctors' offices and not in a hospital setting. Acupuncture alone is not going to solve this problem, but its more widespread use could make a very important contribution. So I like this study because it's a head-to-head acupuncture versus a very, very serious and potentially addictive, and no, I shouldn't say potentially, it is an addictive drug. Morphine is an addictive drug. All right, so while we're on the topic of drugs, every year millions of Americans are prescribed oral corticosteroid drugs. The drugs were introduced in 1949. They're used to treat all manner of conditions, and they're popular because they offer really rapid relief of symptoms for patients. Many of these steroid prescriptions are for short periods of time and at low doses, and it leads people to believe that maybe there's not a problem. However, corticosteroid drugs are some of the most common causes for hospital admission for adverse drug effects. Considerable research has looked at ways to minimize risk when they are used for long-term, with widespread agreement that the risks are significant. I haven't talked to a doctor who doesn't agree with that. But much less effort has been invested in looking at risks associated with short-term use defined as 30 days or less. So according to a new study, within 30 days of starting steroid drugs, and even when taking low doses for short periods of time, patients have twice the risk of fractures, 3 times the risk of thromboembolism, and 5 times the risk of sepsis. The increased risk of side effects began for these patients within 30 days and persisted at doses of less than 20 milligrams per day. The data were taken from a large national database of insurance claims, which showed that 20% of adults in the database were prescribed short-term oral steroid drugs during the 3-year study. The study subjects were an average of 45.5 years old, and the average time of use was only 6 days. The 6 most common reasons for taking the drugs were listed as upper respiratory infections, spinal conditions, and vertebral disc disorders, allergies, bronchitis, and other lower respiratory tract disorders. Almost half of the prescriptions for steroids were written for these conditions, most of which could be treated very, very effectively without the use of a drug that carries this type of risk. The types of doctors that most commonly prescribed the drugs were family practice doctors and internists. There was considerable geographic variation in the prescribing practices, which tells us that this is a subjective decision to use these drugs, and some people clearly favor them more than others do. Almost half of the prescriptions written were for a 6-day prepackaged dose pack, which tapers the dose from highest to lowest, is often more expensive than individual pills, and also often starts with a higher dose that is warranted medically. The researchers wrote that one of the challenges of addressing this issue, which is that far fewer people should be taking these drugs than are taking these drugs, is the vast number of conditions for which they're prescribed and the number of different specialties of doctors who are involved in prescribing them. They advise that early general medical education should include more guidance about how to limit steroid prescribing to only those conditions for which it is absolutely required and where evidence actually supports use, and the risks also of prescribing the drugs. I think that most doctors are not aware that low doses for short periods of time can cause the problems that I've outlined here. They also advise that the smallest dose possible should be prescribed, and alternatives should be used whenever possible. And I have to say, looking at this data, every single condition for which steroids were prescribed in that top group that I mentioned, there are better options and safer options available. So the steroid situation is almost like the antibiotic situation, just way too much overprescribing instead of really limiting these drugs for the things that they really are good for. All right, that's all for today and all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.